Positional plagiocephaly is the flattening of a baby's head shape, and this can happen before birth or after birth. Before birth or in utero is due to the positioning of the child within the womb, and it could also be due to a number of factors, or like low amniotic fluid, and as a consequence of this they can develop posterior flattening. And after birth it's normally due to the way the baby sleeps, and because of the back to sleep campaign to reduce cot death syndrome, it is mainly positional. As a consequence they have this posterior flattening. There are basically three types of head shape. There's the plagiocephaly or the asymmetry, and there is the brachycephaly, which is the flattening all the way across the back, and the final one, which is called the dolichocephaly or scaphocephaly, which is the elongation of the head shape. And we take hand measurements to determine the level of severity. Some children can have a combination of the asymmetry and the plagio, which is quite common, or one or the other. There's two ways of treating flathead syndrome. One is through natural repositioning, and this can be in the first 3 months of their life, alternated from side to side, use of pillows, and also using a tummy time regime, and this can help to correct the head shape. If that doesn't work, and we normally tell parents that up to about 6 months of age, if it hasn't naturally corrected, then the alternative is to go for the cranial helmets. So this is a typical cranial band that we make. This is called the LOCband or the LOCband. Again, it's a dynamic active remoulding cranial band. It's manufactured from a copolymer plastic outer shell with a thick foam lining material inside. We're taking hand measurements all the way through treatment, and based on the measurements we will do the necessary adjustments all the way through treatment. The ideal age group to start is between 4 and 7 months of age, because that's when the skull is at its softest, and we get very good results with that. Now we can treat up to 16 or 18 months, provided the cranial plates have not fully fused, although in those older child the success rate is not as good as it would be in a younger child, because obviously the cranial plates are beginning to fuse. All the children that we have treated, and provided the parents follow the protocol and the wear guide, they've all had measurable success rates.